This video will demonstrate the steps of a percutaneous nephrolithotomy. This patient has a large stone in her kidney. Insert the cystoscope. Insert the catheter into the patient's ureter. Insert the guide wire through the catheter up to the kidney. Remove the catheter and cystoscope. The guide wire remains. Slide the occlusion balloon over the guide wire up to the ureteropelvic junction. Inflate the balloon through the lure lock connector. Remove the guide wire. Inject contrast material to confirm the location of the balloon and its occlusion of the ureter. Direct an entry needle straight into the calyx until contact is made with the stone. Remove the core of the needle. Urine drops confirm access into the kidney. Insert the wire through the needle sheath. Deflate the occlusion balloon and remove it. Slide the needle sheath off the wire and remove it from the kidney. Guide the burn torqueable catheter over the guide wire and into the open area of the renal pelvis. Back the guide wire up to the stone, leaving a portion of the wire's tip outside the catheter. Twist the catheter handle to advance the wire past the stone towards the ureteropelvic junction, down the ureter, and into the bladder. Remove the catheter. Slide an 8-10 French dilator sheath over the guide wire. Slide the 8 French dilator past the stone and into the upper ureter. Slide the 10 French dilator past the stone and into the upper ureter. Remove the 8 French dilator. Insert the stiff working wire through the 10 French dilator down into the bladder. Remove the 10 French dilator. Incise the skin in the back through the connective tissue in order to widen the existing puncture. Slide the balloon catheter over the stiff wire up to the stone. Inflate the balloon to the appropriate pressure. Slowly insert the renal sheath, twisting clockwise and counterclockwise until reaching the stone. Deflate and remove the balloon catheter. Both wires remain in place. Insert the nephroscope into the sheath. Guide the pneumatic and ultrasonic lithotripter through the working channel of the nephroscope. Perform lithotripsy to break up the stone. The time of destruction varies based on the type and density of stone, available tools, and lithotripsy devices. Irrigate and remove smaller stones using the lithotripter probe. Remove the lithotripter. Insert rigid graspers through the nephroscope to collect stones. Remove the stones and the scope. Insert the flexible cystoscope. Look for remaining stones in the calyces. Insert the basket into the scope to capture the stone. Remove the stone and cystoscope. Insert the nephrostomy drainage catheter into the sheath over the working wire. Remove the inner stylet from the catheter to enable the catheter to open inside the kidney. Remove the stiff working wire from the catheter. Using the syringe, inject contrast through the catheter to confirm its proper placement on X-ray. Remove the renal sheath and the remaining guide wire to complete the procedure.